Hello everyone, my name is Rahul Eknath Pawar from second year MBBS student from Dr. Ullas Patil Medical College, Jalgaon. Our today's topic of discussion is cephalosporins. Let's start with the introduction. Cephalosporin are a group of semi-synthetic antibiotic derived from cephalosporin C obtained from the fungus Cephalosporium. Cephalosporin nucleus consists of beta-lactam ring fused to dihydrothiazine ring. All cephalosporin are bactericidal. Cephalosporins have same mechanism of action as penicillin, that is inhibition of the cell wall synthesis. Cephalosporins have been divided into 5 generations numbered from 1 to 5. Cephalosporins differs by number 1 antibacterial spectrum and relative potency against the specific organism. Second, susceptibility to the beta-lactamases elaborated by the different organisms. Third, pharmacokinetic properties. First generation cephalosporin include cefazolin, cefalexin, cefatoxil. Second generation cephalosporin include cefuroxime, cefoxitin. Now third generation cephalosporin include cefatoxime, cefixime, ceftriaxone. Fourth generation cephalosporin include cefepime, cefpyrone. Fifth generation cephalosporin include ceftaroline, fosamil, etc. First generation, now let's start with the first generation cephalosporin. They have high activity against the gram-positive bacteria but weaker against the gram-negative bacteria. Now cephaloxolin, first generation cephalosporin that is active against the most penicillin G sensitive organism. It can be given intramuscular but mild painful as well as intravenous and has a longer half-time due to the slower tubular secretion. It is preferred parenteral first generation cephalosporin, especially for the surgical prophylaxis. Next is cefalexin, most commonly used orally effective first generation cephalosporin. Its plasma protein binding is low. It is less active against the Haemophilus influenza. Next is cefadroxil. It has a good tissue penetration ability, exert more sustained action at the site of injection. It is excreted unchanged in the urine. Its dose needs to be reduced only if creatinine clearance is less than 50 ml per minute. Now second generation cephalosporins. They are more active against the gram-negative bacteria with some strains resistance against the first generation cephalosporin. They are weaker than the first generation cephalosporin in case of gram-positive bacteria. Second generation cephalosporin is cefuroxime. It is resistant to gram-negative lactamases, has high activity against the organisms producing these enzymes. It can be employed for the single dose intramuscular therapy of the gonorrhea due to PPNG. Next is cefuroxime exitil. It is a ester of the cefuroxime. It is effective orally despite incomplete oral absorption due to its ability to achieve therapeutic level in the bloodstream. Next is cefaclor. It retains significant activity by the oral route. It is more active than the first generation compound against the Haemophilus influenza and the E. coli. Last one is a ceprozil. It has a good oral absorption, approximately 90% with the augmented activity against the Streptococcus and the Streptococcus pneumoniae. It has a half-life is around 1.3 hours. Primary indications of ceprozil are the bronchitis, ENT and the skin infections. Now MCQs. First, most commonly used orally effective first generation cephalosporin is option A cefazolin, option B cefuroxime, option C cefaclor, option D cefalexin. The correct answer is option D cefalexin. Second, which of the following is resistant to gram-negative beta-lactamases? Option A cefepime, option B cefuroxime, option C ceprozil, option D cefixime. The correct answer is option B cefuroxime. Thank you.